Are you planning to work as a nurse in New Zealand? Before you start your IQN journey, you must understand the culture, the communication style, and the code of rights that guide every clinical decision here. Welcome to NZ Nurse IQN Prep. This channel helps internationally qualified nurses understand New Zealand healthcare, pass the IQN process, and adapt confidently to Kiwi clinical practice. Part 1. What makes NZ nursing culture different? New Zealand nursing culture is built on partnership, respect, and patient-centred care. You will notice that nurses communicate calmly, clearly, and with a strong focus on safety. Hierarchy is not rigid. Everyone, including HCAs, students, and junior nurses, is encouraged to speak up if they notice a safety risk. Part 2. How nurses communicate. In New Zealand, Kiwi nurses tend to use simple, direct, and friendly communication. They avoid sounding too formal or too hierarchical. They also check understanding frequently, especially with Maori and culturally diverse patients. You will often hear phrases like, "How are you feeling today? Can I check in with you?" or "Let me know if you have any concerns." Part 3. The Code of Health and Disability Services Consumers' Rights. Every nurse in New Zealand must follow the Code of Rights. The rights of consumers and the duties of providers under this code are as follows. The rights 1. Right to be treated with respect. Consumers have the right to be treated with respect and have their privacy respected. 2. Right to freedom from discrimination, coercion, harassment, and exploitation. Consumers must be free from any form of mistreatment. 3. Right to dignity and independence. Services should be provided in a way that respects the individual's dignity and independence. 4. Right to services of an appropriate standard. Consumers have the right to services provided with reasonable care and skill that comply with professional and ethical standards. 5. Right to effective communication. Consumers must receive clear communication that they can understand. 6. Right to be fully informed. Consumers have the right to complete information about their treatment, including benefits, risks, and alternatives. 7. Right to make an informed choice and give informed consent. Consumers have the right to make choices about their care and give their informed consent. 8. Right to support. Consumers have the right to have a support person with them. 9. Rights in respect of teaching or research. Consumers have rights regarding their involvement in any teaching or research. 10. Right to complain. Consumers have the right to make a complaint about the services they receive. This code protects patients, but it also guides your daily clinical practice. If you don't follow the code, even small communication mistakes can become serious professional issues. Part 4. Common challenges for IQNs. International nurses often struggle with speaking up early, documenting clearly, explaining care in simple plain English, and asking for help when unsure. These are normal challenges and part of adapting to Kiwi culture. If you want to learn more about New Zealand healthcare culture, communication skills, and IQN preparation, make sure to subscribe and watch the next lesson.